Hello, my name is Dr. Rafael Garcia. I'm a physician from Corpus Christi. I went to Carroll High School and came back after my training, and I've been working in the emergency departments in Corpus Christi and surrounding areas for the last 25 years. About 5 years ago, I decided to go into primary care, and I found that I was able to take time and listen to my patients after transitioning into primary care. You get an opportunity for a deeper, ongoing relationship with your patients. And that's what I found with Rose. I was able to listen to her, listen to what she was saying. And one of the best things that you learn in college and medical school and residency is that the patient will tell you what's wrong with them. And so I don't have to figure out what's wrong with the patient. They're going to tell me what's wrong with them. And I'm going to listen to them, because it's very important to listen to the patient. Pain is an inherently subjective experience. So there's no way for me to tell how much pain you're in or you're in. There's no way for me to tell how much pain she's in. So I have to talk to her, and I have to sit down, and I have to look her in the eyes, and I have to say, what's wrong? What can we do for you? What kind of pain are you having? And then I have to take that subjective evaluation. There's no blood draw, there's no imaging study, there's no biomarkers that can fully capture the intensity, quality, and impact on human pain, and on human life. There's never ever a place for judgment or minimization of what a patient feels. As a physician, our first and foremost powerful tool is listening. Careful, unhurried attention, and genuine curiosity. When we truly listen, we move beyond the pain score or a chart to understand how this is impacting the patient. How is your sleep? How is your work, your relationships, your mood, your ability to function? Are you able to find joy in things that maybe you didn't before? The other thing that I like to tell my fellow physicians is that we have to be careful with medical gaslighting. And so medical gaslighting is all gaslighting. Is somebody telling you what you're experiencing, you're not experiencing it. And so you're crazy. It's not really pain, it's in your head. The pain can be physiologic, functional, psychological. Chronic pain rewires the nervous system. So people with chronic pain become more sensitive to pain. Increased risks of depression, anxiety, isolation, and cardiovascular issues. At the same time, we have a sacred duty not to create new problems. And we did that a couple of years ago. We created a lot of new problems by treating everybody with pain medicine. So then we created an entire group of people that were addicted to pain medicine, and they needed the pain medicine just to get out of the normal place that they were at to a normal place. So this is called medical gaslighting, a painful reality that the Burning Rose Foundation works hard to address. It occurs when and you may have noticed it, you go to your doctor and you complain of a headache, or you complain of a cough, or you complain of a medical problem, and they tell you that there's nothing going on, dismissed, minimized, attributed solely to anxiety. Maybe there's a lot of stress at home, and they invalidate your pain. They invalidate your experience, and they brush you off, and that erodes your trust in the medical community. And we're not all like that. I don't know if it's because I did ER for 25 years before going into primary care, but first thing I say when I see a patient is, what can I do for you? What can I do for you? And then that allows them to open up and tell me what's going on. Not, oh, you stubbed your toe, you need medication for that, or you have a headache. I learned a headache could be a migraine, it could be a subarachnoid hemorrhage, it could be a brain tumor. So I have to listen to find out what's wrong with you. And that's what I do in my practice. I moved away from corporate medicine, and I have a single practice. I'm the only person that you'll see besides my wife, and she's an LVN, she's a practice manager. And if you come in, I'm going to listen to you, and we're going to figure out what's wrong. We have to make sure, though, that we don't worsen the situation by just piling on opiates. Opiates are, in short circumstances and in specific reasons, are important. But the idea that we're just going to give you an OxyContin and kick you out so you're pain-free for a couple of days is not going to solve your problem. So we use a multimodal approach. We listen, stating with the belief in the patient's experience, non-opioid medications, physical therapy, interventional procedures, nerve blocks, behavioral modification, mindfulness, acupuncture, and the new medications that are coming out that are cutting edge. Because pain is a very difficult situation. If your opiate receptor is in pain, I can give you morphine, and your pain is going to go away. But then you're going to get euphoric, and then you're going to want that again. And then I can give it to you again, and your pain's going to go away. And then after a year, you're going to need 5 times as much pain medicine to get the same effect. So that is not where we go with some of these prices. Now, if you break your leg, you're going to get morphine. Okay? We're not talking about not giving you pain medicine when you need it, but there are different alternatives for this, the way to treat this. It's a balanced approach, and I think that's what the Burning Rose Foundation champions. Safe, effective pain management that honors both the patient's reality and medical realities. We support those navigating chronic illness, trauma, addiction recovery, and difficult healthcare experiences by advocating for provider accountability and systemic change while offering compassion and community. And I am very much against this new term, medical gaslighting, because I don't know how many people have been told, it's all in your head. Your problem is all in your head. You don't really have a medical problem. And if somebody comes in with a cough, I don't say, oh, you have a cold. I make sure you don't have lung cancer. I make sure you don't have pneumonia. So you have to listen to the patient, find out what their needs are. And then this is to my fellow clinicians. Let us sharpen our listening as fiercely as we sharpen our diagnostic skills. Let us combat gaslighting by committing to curiosity over assumption. To patients and advocates here today, your voice matters. Keep speaking your truth. Keep telling the doctor that that's not the problem, that they don't have a handle on what your problem is. They're on a 15-minute clock. Well, you might have to make them go over that 15 minutes. I don't have a clock. I get in trouble because I take too long with my patients. Heather will come into the room and say, you have 2 other patients out there, and they understand that I'm in with somebody who's sick, and they generally don't give me too much of trouble over the fact that I'm taking too long, because I'm treating them the same way that I'm going to treat the other patients. And I'm going to listen, and I'm going to find out what the problem is, and I'm going to offer my help. And I left some flyers for my practice. It's me. I'm the only one there. I'm the only doctor there. And like with Rose, I take care of her. First time I came in, she was afraid because it was a doctor. And she's not afraid of me anymore. Thank you.